Hi everyone, and welcome to today's interview. Extremely excited to have a really good friend of mine, Dr. Rob at Szabo, join us today. And Rob and I met about 3 years ago now, I believe, and I think the stars really aligned for us in that meeting because we are both very much on the same wavelength. So Rob is a GP, and he practices mainly out of a practice in Baldwin at the moment. He also runs a clinic called the Low Carb Clinic. And Rob and I met and began referring to one another and very quickly realised that we were very much on the same page when it came to nutrition and the way that we thought about things. So before I go into any more detail about Rob, I'm actually going to get him to tell you his story of how he ended up a real believer in a low carb, high fat approach to diet and lifestyle, and how he integrated it into his own life personally, and then continue to do that on a professional level within his practice. So welcome, Rob, and thanks so much for being with us today.
Thanks so much, Vicky. That's a really lovely introduction. Thank you. And I agree. I think it was very much that we're on the same page and the stars aligned, and it's been quite a symbiotic relationship that professionally that we've been able to refer back to each other and know what each other's talking about and understand each other. So that's great that we both speak the same language when it comes to low carb and the power that it can have in terms of improving people's health. So your question was how it was that I first got to be involved in this and develop my knowledge in this area. And it was really, like a lot of people who work in this area, it came about through my own personal health journey, and that involved quite a shock diagnosis of type 2 diabetes at the age of 37, which was 5 years ago now. And I was feeling fine, and it was just an insurance medical that I was having. So the blood tests are expected to be fine, but they weren't. They were very abnormal. I wasn't particularly overweight. I mean, I was about 10 kilos heavier than I am now. That's kind of where it all kind of catapulted from. I did all the things that I was told. I went and saw a specialist and was put on some metformin, a tablet. And about a year into my diagnosis, and I discovered low carb, and someone said to me, a good friend said that there's people talking about being able to reverse type 2 diabetes on low carb, and I'd never heard of this, and so I did a whole bunch of research, and it all made sense. And just one day decided to stop my metformin and stopped eating carbohydrates and checked my blood sugars really closely, and they were all fine. So that kind of began the journey, and after getting better and better results as time went on, I just thought, well, look, now that I have this knowledge, I can't not implement it with my patients, and started to implement it in practice with similarly fantastic results, and discovered all the extra uses that you can apply low carb into in terms of weight loss and in terms of improved energy levels, just greater vitality and overall health, reversing polycystic ovarian syndrome, a whole bunch of stuff, better managing type 1 diabetes. So there's just so many applications, and that just sort of became quite exciting. And I guess then I just felt like I needed to have a dedicated clinic to this. So I developed a clinic called the Low Carb Clinic a couple of years ago now. And we've actually just moved to Deepdene, which is right next door to Baldwin. And that's where I see my patients for low carb. Work with a dietitian, and we do face-to-face consultations there. And basically, I guess I'm a specialist insofar as the GP is a specialist. We're called generalists, but we do, exams. But this, I guess, is it's not a general practice. It's specifically for reversing these diseases. And it's just a limited time frame, that we like to see patients for, hopefully get them on track, help them lose weight, help them reverse their diabetes, improve their diabetes, learn how to continue to do this. And then, I guess after a period of months or years, depending, send them back to their GP, far healthier than they were when they first came. So that's kind of the way that our clinic works. And it's been really great. There's been great take-up. And there's not a day that I'm there where I don't think how fantastic it is in terms of, you know, the work that we can do. It's really so rewarding. And my patients are my inspiration, actually, because, you know, when I see what they achieve, it's just really great, because I could never get that kind of result in standard practice.
Yeah, that's fantastic. And I'm sure there's lots of people going, oh, wow, that's really refreshing to hear that from a GP, because I know from my point of view, I get a lot of people really struggling to convince their GPs that what they're doing is going to be beneficial, and you know, what they're doing is an attempt to reduce medications. And you mentioned there that, you know, you stopped taking your metformin and implemented the low carb diet yourself, and obviously you had that knowledge to allow you to do that. But what do you recommend to people who are potentially, you know, diabetic or on blood pressure medication, or any sort of medication that when they implement the low carb diet is going to change the need for that? How do they go about modifying it if they have a GP who is maybe not quite on board with low carb?
Well, I guess, great, thanks for raising that, because obviously, you know, as I was saying, that I was conscious of the fact that, I guess, you know, with my knowledge, it was easy for me to make that kind of adjustment, but I think it can be potentially dangerous for people to do that themselves. And so it is better to have medical supervision when having medication adjustments. But as you said, equally, a low carb diet can be just so powerful in terms of how it changes the way your body functions and your requirement for medication. So what I'd suggest is that if people are on medications, that soon after starting low carb, if not before, that they go and talk to their GP. And I guess the thing is, I mean, I've got a couple of things to say about that, but ultimately, if somebody's blood sugars are far better, if somebody's blood pressure is far better, or whatever the case may happen to be, the GP's got to respond to that. And it doesn't matter why it is that those things are better. You know, if it's, you know, the GP should respond, you know, if they're doing their job, they should get some changes happening to the medication once those changes are apparent. So, you know, I guess, sure, the GP may not understand what somebody who's doing low carb is doing. They may not get it, but they'll still have to respond to the changes that they're seeing in front of them. And the other thing to say is that I don't really blame the GP for maybe not getting it. And I mean, I understand, I've heard many times myself, patients telling me that their GP's been antagonistic or kind of derogatory about them doing low carb. And I don't really, although I understand how frustrating that would be, you know, if I would imagine if that was me, I'd be incredibly frustrated by my GP. But I don't blame the GP, because, you know, doctors get into this profession because we want to do the right thing, by and large, you know, not everybody, but most of us. And we are raised to, we're sort of, I guess, we tend to be very much driven by believing that our authority figures are telling us what's right. And we've had our whole, you know, years and years of education that we've gone through telling us that this is right. And they're all very learned, intelligent people. And we've come to respect that knowledge. And for it to just kind of be flipped on its head is pretty hard to swallow if you haven't had that experience. And I guess, you know, I'm fortunate, and I consider myself fortunate with my diagnosis to have had that experience, because I could see for myself in my own, you know, in the fear that comes from having a disease, and you know, it's a very, very visceral experience to actually go through a diagnosis where you think, you know, lots of swear words, my life is going to be really dramatically altered. So I've had this personal experience, and most GPs don't have that. So, I mean, I guess it's very easy for me to sort of say, oh, they don't know what they're talking about, you know, but the reality is that when there's so much to know in general practice in medicine, then we have to trust what we're told. We can't go and have to evaluate everything for ourselves every time we're told something, because if we did that, we would never get time to do anything else. We wouldn't have time to sleep. So we do need to trust what we're told in order to actually move forward and be a doctor. So I can understand why GPs don't get it. And I mean, it doesn't make it any easier to the patient who's very frustrated by this. I guess what I'm saying is that it's going to be a learning process, and some GPs are open and some GPs are very closed. And for those ones that are open, I think it's really great if your patients, clients, the people who are listening to this can kind of walk their GP through what they're doing, you know, and there might be some sort of educational value to that. So I'd really encourage that, you know, and some GPs are not going to be receptive, and maybe it's time to move on to that patient in that situation. Because you need to have a GP who's on your side. That's our job.
Yeah, I agree with all of that. And there's some really great points that you raised there, you know, about not blaming a GP or getting angry, but just recognizing that they were taught specific ways and slowly trying to introduce them to something new.
Right.
I mean, I've heard of many of my clients, you know, buying a copy of someone like Stephen Finney and Jeff Follock's book and to their GP to have a read through. And, you know, so little strategies like that, maybe.
Right.
You were really, to stick with your current GP that you've maybe had a relationship for many, many years.
Right, exactly.
Yeah. So, Rob, we had a chat, well, I had a chat with Ken Sakaris, Professor Ken Sakaris, who you obviously know really well.
Yep.
And for those of you who haven't yet watched the Ken video and interview, he spoke about the, you know, everything around cholesterol and our blood tests that we get and what we want to look at when we're following a low-carb diet. And so we went into all the pathology side of that with Ken. But I guess from a practical point of view, the issue of cholesterol is one that comes up time and time again. People will come in and they'll say, oh, I've been doing low carb, my cholesterol has increased, I've gone to my GP, they want to increase my medication or they want to put me onto medication, and what do I do? And what is your sort of recommendations in this regard?
Yeah, you're right, it is a pretty common question. The key thing to realise about, I think, statins, or the medications that we're talking about here, are that I have a different view, and I think my view is more aligned to what Ken Sakaris' view is. I think that they're probably poorly named as cholesterol lowering agents. They do that, but that's probably, I think, not how they're working. They're probably working via an anti-inflammatory mechanism. And we know, well, there's lots of suggestions to this, because we have studies that show that if you lower your cholesterol through having a low-fat diet, I don't recommend it, but if you do that, there is no impact on your risk of having a heart attack, right? So changing that number through other means other than taking a statin, whether it's with diet, doesn't have an impact on your risk. There's other medications that are different to statins, other categories of cholesterol lowering agents that lower cholesterol. They also have been shown to not have an impact on risk. Statins have been shown to have an impact on risk, and they do lower cholesterol, which to me, in the light of all that other evidence, suggests that it's probably a red herring. They're probably not working that way, right? And we know that they're really powerful anti-inflammatories. So these cholesterol lowering drugs, I think it's a bad name. I think they should be called cardiovascular risk reduction drugs, or maybe something a bit more catchy. but certainly not. Look, they do lower cholesterol, but like I said, I think that's a moot point, really. When determining, I mean, I do put people on statins occasionally. I stop a lot more than I start. The question's really got to be, if you think about what I was talking about, they do reduce risk. The more the risk is, the greater the risk in the individual, the greater the potential benefit is going to be from the statin. If somebody has low risk, then their benefit is just so much of a slither of a benefit that the side effects start to become relevant, and you start to think, is the increased risk of dementia, increased risk of diabetes, and high risk of relatively high risk of muscle aches worth the marginal, if any, benefit that you're going to get if you're low risk? And the answer is probably no. You know, the side effects start to outweigh the cons start to outweigh the pros. So I don't look at cholesterol numbers per se. I mean, there is certain elements that Ken would have spoken about in the cholesterol profile, things like high triglyceride, things like low HDL, those sorts of things can be risky, but they just add to the total picture of risk. And it's really looking at that total picture of risk is where we need to think about whether or not statins are the right thing for that individual. So you need to look at the whole picture. Lots of things come into that. Family history, smoking status, out of control diabetes, past heart disease, past strokes, all sorts of things come into that. Whether you do a coronary artery calcium score, which is a scan you can do on your heart. So there's a whole bunch of things that can come into that. And there's cardiovascular risk calculators that you can do that can give you an estimate of what the percentage risk is. So that's how I approach whether or not someone should be on a statin rather than just their number.
Yeah, and that makes a lot of sense to me. I often speak to people as it's like putting a bit of a jigsaw puzzle together and pulling all the risk factors in or all the little pieces, and we're trying to create a picture, and everybody's picture is slightly different. So it's really looking at that person from an individual point of view and trying to work all those things out before going, X equals.
Right.
Yeah.
Yep.
Okay, great. That makes sense. So a lot of people, I think, who are in this 6-week challenge and who will be listening to this, and I see a lot of people one-on-one as well. I get people coming in fatigued, overweight, just really struggling with energy levels, stress, and they often question me and often bring up issues around thyroid. Could I possibly have a thyroid issue, or suggested that I might have a thyroid issue? So first of all, what would the symptoms be related to low thyroid levels? And then how or does a low carb, higher fat approach to diet impact that in a good way, or how? Or maybe you can shed some light in the area of this thyroid area.
Yeah, well, look, I think it's probably overplayed. I don't think it's as big as an issue as people suspect. The problem with thyroid symptoms is that they're completely non-specific. So, basically anything can give you the symptoms that, the low thyroid can give you, or thyroid disease can give you. So it can be loss of energy, it can be insomnia, it can be feeling depressed, it can be gaining lots of weight. So you can see, as I list those things, lots of things can actually cause any one of those. So you can't really go on a symptom to say that you've got thyroid disease. You need to look at blood tests, because it can be basically just, any number of illnesses that can produce those. And I generally find that the blood tests in most people are normal. So I think it's probably an overcall. And I think, yes, it is a hormonal problem. In a lot of cases, it's an insulin hormone problem, which perhaps you've spoken about with people on the challenge. But, I think it's that hormone insulin that we need to be talking about more than thyroid. In terms of how the diet impacts, look, I don't generally see it impacting hugely. Potentially, I have heard of there being a possibility of a low carb diet indicating that it looks as though you might be low in thyroid hormone, but I haven't seen that myself. I generally check thyroid levels before and after people have gone on a low carb diet, and I generally don't find any great difference.
Yeah. I definitely agree with you on all those points, and I speak a lot about insulin, and that's really my focus in this challenge and with my clients, and trying to get people to understand how this hormone works and how it influences other hormones. And so absolutely, that's a major focus, and I think a little bit of re-education around that is
I mean, there's rock solid evidence on the insulin story, and when we fix insulin, I mean, I know you find this too, and I certainly find this, that people feel great, generally speaking. And so let's focus on where the rock solid evidence is. And maybe there are a few people where, you know, rarely where the blood tests are difficult to interpret that may have mild thyroid issues, but I don't find that to be a major issue. You know, I generally find that if people's insulin situation is sorted out, that fixes things in most cases. So I just think let's go to where the science is.
Yeah, yep, totally agree with you on that one. Yeah. So another area, and I guess I'll use an example here in that we both know Dr. Peter Bruckner, who,
Yep.
for those of you who don't know him, is the doctor for the Australian cricket team. I don't think they'd be too proud of that right now, but anyway.
Well, former, he used to be. He's recently retired.
Well, there you go. He's probably did it at the right time.
Yeah, exactly. Yeah.
Peter was quite instrumental in implementing a lower carb approach to the Australian cricketers a number of years back. And one of his greatest findings was that he found that players who had chronic injuries were suddenly requiring less cortisone and steroid medication, or, you know, pain was just significantly reduced, and there were many benefits in terms of recovery and that sort of thing. So maybe you can give us a little bit of an explanation around why that's happening and how that could apply to the general person who's just active and wants to feel better.
Yeah, look, it comes down to that inflammation story again, I think. You know, and I measure an inflammatory marker, a CRP, on a regular basis with people, and I pretty much consistently find them when people go on a low carb diet, even if their CRP is not elevated, even if it's within the normal range, even within the normal range, it'll come down after a few months of being on a low carb diet. And if you think about just that overall level of inflammation in your whole body, if you have an injury, it's going to fire it up a whole lot more than if you didn't have that inflammation. So I think that's going to be a big element, that your body is less inflamed. And the other thing is that if you're having a good whole foods diet that doesn't involve things like, you know, biscuits and all sorts of confectionaries and things like that that are not food, they're pretend food, you're not going to be getting nearly as much omega-6 fatty acid, which is the cheap, damaged vegetable oils that are included in all these products. You know, that's what goes into Nutella, that's what goes into biscuits, that's what goes into ice creams. You know, it's just rubbish, and it's really inflammatory. These omega-6 fatty acids are so inflammatory. And when you then replace that with some better fats that are, let's just say, we're very lucky in Australia that we've got lots of grass-fed dairy, grass-fed beef and lamb. If you can get some of that, then you're going to get lots more omega-3, which is going to de-inflame your body. And when it comes to things like tendon injuries, these are really, really important, because what you're eating is what you're made of. You know, these things are structural components of what makes us up. You know, it's a bit like saying, what kind of house do you want? You know, is it going to be made of really high quality materials, and then you're going to need to get a delivery of those materials to the building site, you know, or do you want to get it built from straw bales, you know, that are going to blow away, you know? And so really what you give to yourself, what you eat, is going to be what you're going to be made of. And if you're made of inflammatory omega-6 fatty acids, no surprise there that you're going to be feeling sore.
Yeah, absolutely. And from another inflammatory point of view, I reckon the gut is one of those things that we see big changes when people start a lower carb diet. And I know often within the first few weeks, people just feel so much better within their gut. They're not bloated, they are more regular, and those sorts of things start happening on the level of the gut. Is that your experience as well?
Yeah, very much so. Look, it varies enormously from person to person, and some people who have had those bloating symptoms, had a lot of gas, had maybe the odd bit of diarrhea, a lot of those people, they'll normalise to having regular motions, which are really good. Some other people who have been regular might actually end up becoming constipated, and we need to add a fibre supplement into their diet. And I kind of wonder actually in those people whether maybe the irritation they were getting in the gut from things like grains and sugars was actually what was maintaining their regularity. You know, maybe that was actually was propelling things, this irritation in their gut. And without that, they just need more fibre. And I mean, the reality is that estimates have shown that our recommended fibre intake, which most of us are not getting, but our recommended fibre intake is about 1/10 of what a human would get in our natural environment, that is in the bush as a hunter. So, you know, there's really a huge disparity in terms of what fibre we do get, even when we're eating lots of vegetables, compared to what most humans in nature would be getting. Now, there's exceptions to that. There's people like the Inuit that wouldn't have any fibre at all, but they have a very, very different diet altogether. So we need to look, you know, at them in a kind of unique sense, because they're very ketogenic and potentially you don't need fibre necessarily. You know, if you look at populations like that, there's actually populations that are very healthy in nature that don't have any fibre in their diet. But I do think there's potential to do a lot of good with having fibre. And for those people particularly who are struggling with regularity, adding more fibre in through some psyllium husks or some chia seeds, or, you know, there's a whole bunch of different things that I'm sure you talk about are a good idea to get regularity going again.
Yeah, and absolutely. It is a big issue that we see time and time again, and people going to either direction at first. And in my experience is that this usually resolves over time. And so maybe those fibre supplements just help things along initially, and then
Right.
people become more accustomed to this way of eating. They no longer require them.
Yeah, quite often. Yeah.
Yeah. So to finish off with this, maybe you can, if you can think off the top of your head, putting you here on the spot a bit, but have you had any real surprise case studies or people that you know, have implemented a low carb diet and you've just gone, wow, that is just amazing? Something that you'd like to share with everyone?
Well, probably the thing that really comes to mind is people that have got chronic pain, and people that are experiencing fibromyalgia or chronic fatigue syndrome as well. I found that it can be incredibly useful for the majority of people in that situation. And I certainly wasn't expecting to see that. You know, I've had a specialist, a rheumatologist, Daniel Lewis, who referred quite a few patients with those conditions to me to teach how to get onto a low carb diet. And it's been extraordinary in terms of what I kind of perceive to be, I haven't got studies for this, but just my perception in terms of the degree of benefit that people get. It's quite amazing just how much more, you know, people have often described having been in a fog for years or decades and that fog lifting. People describe, you know, they've been sore just all over their body just to touch for years and that going away. So there just seems to be such a variety of applications to this. And I mean, I heard the saying, and I don't know, it's like a big hammer, you know, and there's lots of nails for a big hammer. And it just seems to really, you know, even people who have felt that they're healthy, that they feel fine, that are going along in life without any obvious illness or perhaps not even carrying much excess weight at all, it's very unusual to not hear from them how much better they feel on a low carb and how much more energy they've got, how much less reliant on eating all the time they are, and how much more concentration they have. So, look, I guess, you know, that's something that, I mean, it was all very obvious to me about the diabetes and the weight loss, but all of these other things has just been really very eye-opening and makes me think, wow, you know, that we're really onto something here.
Yeah, definitely. And it's pretty exciting. And we sort of speak about all these things, but each case is exciting in itself. And when you, for me, you know, each person who comes in and has had something remarkable, life-changing happen, it's really rewarding as a practitioner.
Right. Spot on. Yeah. And that's what I say. My patients inspire me.
Yeah. Totally agree. Well, that's fantastic. Thank you so much for your time, Rob. I'm sure everyone's going to get heaps out of all of this. Always just good to have a bit of a a gas bag and
yeah,
forget about this topic that we both love so much. So thank you for giving up your time this morning. It's been
pleasure.
wonderful having
Thanks for having me, Vicky.
Yeah, my pleasure. And we'll see you soon.
Okay, bye everyone.